One day it's like, yeah, this is awesome. And then later that day it's like, oh no, what's going on?
What did I do?
What did I do? Or what do I do now? Or whatever.
And we make sure that we get that smile in your face. we make sure that you're able to feel great.
It changed my life, right? I didn't think it was. I never expected to have that kind of impact on life for me. I just want to say it to anybody's looking.
Go for it.
If you're on that fence, and you're thinking you might or you might not, pull the trigger, right? I smile.
That's what it's all about.
Sorry.
Welcome back to Supremedental Podcast. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Don't forget to like and subscribe. Remember, this podcast is meant for you, our patients. And today, we have someone very special here with us. We have a good friend of ours, Mr. Granger.
Hey, how are you, man?
I'm doing great. Tell us a little bit about yourself. Tell us, who is Mr. Granger? Tell us your dental trip, your dental vision, everything you went through.
Sure. You know, it was a journey to get to the point to decide to do this, right? I went through what my insurance covered at work, which was the basic, caps and crowns, and they had done the root canals all the way across the bottom, and it was to the point that it was a year plan with the dentist, and I spent a year in a chair once a week for up to 4 hours, which was horrible, right? And in the end, nothing fit, and I was tired of doing that, and I thought, you know what, I'm gonna get implants. I see them advertised, right? So I check at home in Washington State. I'm up north of Seattle.
Far ways from home.
Yeah, it's a ways, right? But I started checking around and did some research, and I found you guys through Dental Departures, right? And the reviews, I did my homework, and the reviews and everything was like, this is the place. And so one day I just decided to pull the trigger and talked to my wife, and she's like, yeah, okay, well, if you want to do it, right? And that's kind of how I got here. I've been doing dental stuff all my life. And I had tetracycline as a kid, which yellowed my teeth, so I never smiled. And this was an opportunity that I could actually afford to come down and do. And man, yeah. So that's kind of how I got here, right? I live up in the Northwest, beautiful, beautiful country up there, working downtown Seattle. So yeah.
How does it feel to be able to smile again?
I didn't think I was going to get emotional. It's the most incredible thing in the world, man. I mean, you get a chance to smile, and people go, wow, that's a nice smile, right? And in today's world that we live in, when I can flash a big old smile and feel so good about it to people, it brings them, it pulls them out of that negative, and it touches people, changes. You're
gonna make me cry. You're gonna make me cry.
Anyway, it's crazy. It's crazy the change that it changed my life, right? I didn't think it was. I never expected to have that kind of impact on life for me, and it does. So it did. To be able to say, hey, how you doing, right?
Oh man, that was a little bit tough right there. No, that's good. That's good. And a lot of our patients, a lot of people that always smile don't understand what it's like not to smile.
Yeah.
So being able to smile is huge.
Oh,
life changing.
It
brings beauty to the face, beauty to the soul.
It makes you feel good, especially when people smile back. And when you got a big old beautiful smile, man, they always. I very few people. Well, I work in downtown Seattle, so there's some folks down there that, but they smile back. It's just great.
And it's so. I mean, we have different patients that come in, and I'm a big crier myself, man. I'll cry with Mickey Mouse if it's pretty sad sometimes. So But this is the first time that I get teary-eyed at a podcast, so thank you so much, Mr. Carl. So we'll probably have to cut that off. So it's amazing what we can do and what we can change in patients. When a patient walks in through our door, they have hope that they come from far away, and a lot of times they've been told no, or at some point some patients couldn't afford it, or they didn't have time, because sometimes in the U.S. it's a long process, and they're just fed up. They're done. I want to be able to eat. I want to be able to smile.
Oh.
And we have so many. We can go so many different routes.
Right.
And there's a lot of places that take the easy routes, and there's a lot of places like us that we don't take the easy route.
Right.
And we make sure that we get that smile in your face. we make sure that you're able to feel great, because, I mean, you guys walk in and you guys look awesome, but when you guys have teeth, I mean, I can see your pictures of before and after. You guys look so much younger. It's insane.
Right.
It's your eyes glow different. It's like you have a different swagger to yourself.
Boom.
That's just...
And for me, you talk about that, the quality of life.
Right.
Right. That was another big piece for me, was the quality of life. My food wasn't getting chewed up, right? They weren't beaten in the back enough. And
right.
So it was affecting my diet, and that affects all kinds of things. And so another thing, when I weighed this out, I said, what kind of quality of life do I want? Can it make it that much better? Yeah, it did, and then some.
Wow.
So that quality of life, and you talk about in the States, when I checked to do this right here, would have been probably 70 to 80 grand. Just their base price was $55,000. That's a lot of money. I went to a consultation with somebody, and we sat down and went through it. And then I said, well, how much? I'm thinking 30 grand, right? When she gave me that number, I just dropped my mouth. I was like, wow, how do people do that?
Financing.
Well, even the financing, the horrible interest rates on it, right?
Exactly.
And she's like, you've been in your job a long time, right? And I went, well, yeah. She goes, we can draw on your retirement.
401k.
Yeah. I went, that's a year's worth of salary.
Right.
I said, I can't do that, right? And then when I started looking around, I called different spots in the U.S. that the economy was down in. It was always that 55, 60 grand mark. And when I started researching down here, I found you guys, and you had a fantastic package for 15 grand, right? In reality, because I've been down there a few different times, right? I'm probably about 25, counting this trip, which is still, for a working guy, right? That I work a lot of hours, do a lot of overtime, so I could afford to do this stuff.
Definitely.
Right? And it's worth it. It's worth every penny I've spent. But this gives me the opportunity. You gave me the opportunity to get to this, because I could never reach that other high mark. And yeah, did an incredible job.
Welcome to Dental Facts. Did you know a sore jaw combined with chest pain can signal a heart attack, especially in a woman? You heard it first at Supreme Dental Podcast. Floss, brush, and keep smiling.
We had an episode about that aired a couple weeks ago. We had a couple that came in, and they said they just sold their business, and they said they had no problem paying the prices back at home. They really didn't.
Right.
But they seen that we had 8 international accreditations. They seen a couple of things that we've done that we've been mentioned in the New York Times, and they said, we want to go with them. And they came in, and she didn't even wear her wedding ring because she heard horror stories about Mexico and how people were getting picked up from the cartel when they were having tacos and everything, right? So,
yeah.
But she says, you know what? Algodones is secure as any secure city in the United States. If you look for trouble anywhere, you're gonna find it, and that's just plain and simple.
Yeah.
And she said that. One of the things is when you come down here, like you came down here because of the prices were outrageous over there. But I promise you, if you go right now to a dentist in the United States and you show them what you got, first of all, don't let them know you got it from Mexico.
Right.
You let them know you got it in California. And then they're going to be like, wow, they did a great job. And then you let them know you got it in Mexico. And then probably be like, oh, well, it could have been done better. It's just how it is.
You know what would surprise you, and I'm going to branch just a little bit here.
Yeah, go for it.
That after my initial visit, and they did all the work, right?
Right.
I went home, stitched up.
Extractions, implants.
My stitches broke, came open.
Okay.
And I was in a lot of pain. And I read that when you do this kind of thing, the pain usually is 5 days and it'll taper off. I got to like day 9, and I was still like kind of that crying pain, and called and got a local guy who does implants, right? And got an appointment and went in, and they did the scan. And I was waiting for him to come in and go, because I told him up front I'd been down here and got it done. And I was waiting for him to come in and go,
They messed you up.
well, I don't know what you did down there, man, but right? But no, he came in and looked at it, and he looked at me and goes, you know what? They did a damn good job. He goes, they really did a nice job on you. He goes, what happened? It isn't because it was in Mexico, right? He goes, this could have happened here, just as easy. And he offered, he goes, I can stitch you up, but I really don't want to because that gives bacteria a chance to grow an infection. So you're better off just kind of leave it, and you're at day 9. He goes, a couple days, your pain will taper off. And sure enough, a couple days later, tapered off. It blew me away because he's like, they did a good job.
That's awesome. That
Right?
We just had another patient also that I guess somewhere in the family they have something to do with a dental surgeon, and he looked at some bone grafts that we did, and he literally said, like, this is one of the best looking bone grafts that I've seen. We have the doctors that work here with us, they get highly trained, and it's not just in Mexico, like
Yeah.
Spain, Brazil. I talked to you a little bit about, did I talk to you about Supreme TV or no?
No.
So while you're waiting in the waiting room, which
Oh, yeah, you did.
I did.
Yeah.
So we want to be able to be showing our videos, our certifications, our accreditations, places where our doctors actually have been, which is Spain, Switzerland. We just came back from Harvard University,
Yeah.
Argentina, Colombia, Brazil. You know, we're getting training all over the world, not to compete in Algodones. We're doing it to compete worldwide. We're doing to give you guys the best solution to be able to create that smile.
Oh, yeah.
You know?
Change lives, brother. Change lives,
Changing
right?
lives, yeah. It's hashtag smiling starts here.
Right? It does. And it's a journey. Because, again, and if I could talk just about a minute
Go for it.
Coming down for the first time, and I know a lot of you out there probably never been to Mexico. I'd never been to Mexico. I had no idea. And I heard some stories, right?
Right.
And the first time I came down by myself from Seattle, so it was a long trip, not really knowing what to expect because it's a different country. You know, you come through customs and you walk across, and they may or may not stop you. When they do, they don't do a whole lot but inconvenience you, right? And then you got the dogs and the guys with the ARs hanging out.
Big guns.
Right? And so you get across, and then there's people everywhere going, hey, man, you need dentist, you need dentist. And you guys had actually sent somebody out there with a sign.
Yeah.
Right? And so I seen the sign, and it was like, boom. But the first day can be really taxing, right? It can be, prepare, be patient. Because you get here, and again, you don't really know what's going on. You hear a lot of language that you don't understand, right? And I've told myself 3 times I'm going to learn some Spanish, but I haven't done it yet. Anyway, so, and you get in an office, and I converted now, Mexico time and home time.
Yeah.
Right?
Yeah.
It's the service is different, right? They can be different, both be good. So it's not different in a bad way. It's different in a way that I'd never experienced before. And that first day was a long day. And I would say, just be patient, right? When you come down here to Mexico, relax.
Have a margarita.
Right, have a margarita. The place, and you talk about safe. I've walked every corner of this town, right? When I tell people I'm going to Mexico, they go, "Oh, you're going to Mexico?" And I go, "Wait, not the Mexico you're thinking about, right?
Not the one on CNN,
Right? There's no water there, and there's not a lot to do." Which at first I thought this is a drag, but you know what? It forced me to take a break, forced me to slow down.
Yeah.
Get some rest, hang out. And so that first trip, don't question yourself. Do your research. I did my research. I found all good things on you. And every time I come around, you guys are doing something new and building and getting better at what you do. We talked about this earlier, the the initial dentures that you get.
Yeah, the throwaway dentures. Yeah.
That's what we do. And I was told that we were talking, and I was told initially, here these are. They didn't fit, and I was coming out of surgery and all that kind of stuff.
The temporary. Yeah.
And she, well, and don't use them to eat. I'm like, 6 months. What? And now you bolt them in. The temporaries actually bolt in, so you have teeth when you leave that are set.
Yeah, immediate loads. Now we have the teeth in a day. You get surgery, and the next day you have those on, and you're ready to rock and roll.
Yeah. Day 3, you go back home.
Yep.
Come back in 6 months for your second trip, and you know what it's like then because you've been there, right? I haven't seen. Again, if you look for trouble, you'll find it. I don't care what town you're in.
No matter where you're at.
No matter where you're at. But this place, you walk around. I mean, there's a lot of vendors, but they don't. It's not like they accost you or anything. All those stories you hear, I haven't seen any of that. I've seen a truck roll through a couple of times, loaded up with the 50 cal.
Yeah, they keep everything nice and safe.
They roll through, and I mean, this is no different than going anywhere else. This coming here, I feel a little better coming here than I do when I go into Seattle. How's that?
Really? I want to touch up on something that you said. Be patient the first time.
Yes.
When you're down here, we are going to give you the time that you need. So we're going to give you, there's no script, so we can't tell you it's going to be 30 minutes for you and then you're gone. Like if it went from pulling 1 or 2 teeth to be pulling all your teeth, we're going to give you the time and we're going to make sure it's done right. So it may take a little bit longer the first time, especially when you're down here and you have to go get a CAT scan the first time. Then we have to wait for the CAT scan to come in, which in the next 2 months we're going to have our own CAT scan. So we no longer have to do that.
Nice.
So like you said, we are getting better. And everything's in-house, so that's a lot faster.
Mm-hmm.
And so we are getting better. And we are taking a look at everything to get better experiences. But like you said, you hit the nail on the head is be patient. Don't question yourself because then you're going to end up with a smile like yours.
Right.
And that's the end result.
That's the end result. And again, it's been a ride, right? It's an emotional roller coaster. I'm coming, being here for the first time, never being out of the country, saved, worked hard to get the money to do it, don't know what to expect. Right, it's pretty nerve-wracking, and you go through roller coasters where one day it's like, yeah, this is awesome, and then later that day it's like, oh no, what's going on?
What did I do?
What did I do, or what do I do now, or whatever it is, right? But in the end, through this roller coaster, and every single time I ride that roller coaster, and in the end, I smile.
That's what it's all about.
Sorry. In the end, I leave there smiling, and you can't put a price tag on that, really. So, expect a roller coaster. It's emotional. It's a big decision. It's a lot of money, especially for folks like me or us, right? But in the end, it was well worth it. And you do your research, and you'll find Supreme Dental's right at the top. Their doctors are top notch. Their place is clean. It's been overall a great experience. Like I said, there was hiccups, right? There were some hiccups along the way with me. I had some stuff happen where I had to come back down. But every time I did, you bent over backwards to make sure that I was taken care of. You stood behind your work, right? There was never questioned. Warranty, nothing.
You gotta make me cry again. You gotta make me cry again.
We fix it. And every time you did, and I've gotten to the point now where this last time you said, let's upgrade you, right? And you made it possible that I could. It was within a reach for me to do it.
Right.
And look at it.
There it is.
I didn't expect. I mean, I think they look really awesome. And I didn't think I'd get emotional over it, but man, it's just...
That's why we do what we do, man. We have to make sure that you guys leave out of here smiling. So if you come back or something is wrong, we got to make sure we take care of it because you guys put your trust on us.
Yeah.
So it's on us to make sure that you guys walk out of here smiling. So we will do whatever is in our hands. And if it's out of our hands and we need to bring somebody else in, we will do it.
Yeah. It's what you have with me, right? I mean, going back to the whole patience thing, just being patient. And you know what I really didn't grab a hold of, because you only go 10 minutes. It would be 30 minutes, whatever, right? You get tired waiting around, whatever. And I always thought, man, what is going on, right? You know what I figured out is the doctors you have carry to the point that they will pack their schedules as full as they possibly can. And in each appointment, just like at home, things happen. Maybe he's working on somebody and he's got to do a little something extra. And so it stretches that time out a little bit. And they do, and you guys do the best you can to go, hey, I think it's going to be about 5 minutes, or I think it's going to be 20 minutes, or I think it's going to be 30 minutes. But what to remember, while you're here in Mexico to get your teeth done, there's only one thing you have to do. Only one that you're required to do.
You've been saying that.
Go to the dentist and go back when they ask you to come back.
Make your appointments.
Make your appointments and be patient, right? Sit back. Because I know how I realized on this final trip how hard your folks are working. And they're working hard.
Yesterday, they closed the shop at 11:45 p.m.
I was shocked when I looked down.
I said, we're about to start a double shift.
Right.
A graveyard shift. Because I said, this is, it's in our doctors. I've told our doctors, we could tell, sometimes our patients, we let them know, hey, you're going to be down here for this long.
Yeah.
And sometimes we could do it sooner. But our doctors say, well, it's 6 o'clock and the next one comes in 3 hours, the next test. Well, we'll wait. Because they want to make sure they have that extra time so you can go eat something.
Yeah.
And then you could try it out. And I don't make them stay.
Right.
Like, they stay. And I'm just like, it's just crazy. It's crazy. But you can tell when somebody wants to be here.
Yeah.
And the doctors want to help. The doctors look at you guys. And I have so many podcasts, and hopefully you get to watch some, that our doctors are talking about different patients. And they're just like, yeah, man, it's not like it's a number. It's we change people's lives, and just like you, I mean, you're happy. You're gonna go back home. Your biggest billboard that we're gonna have in Seattle. Look at that smile, and people are gonna be like, "Wow, man, that's a great smile," and you're gonna represent us over there. And I'm sure if somebody asks, you're gonna let them know you got it at Supreme Dental.
Yeah, Supreme.
And I am very happy that you came down, and we're very blessed to have you down and to be able to treat you. And I am happy that you have the smile that you deserve. That's a big smile. And I'm not happy that you made me cry twice. But, hey, that's okay. There's always a first time for everything. And I want to thank you once again for being down here, for flying, for choosing us. I know Dental Departures shows you guys our rankings. We have over 6,000 reviews. But you guys put your trust on us.
Yeah.
And your trust, your money, your time, your everything, and we really, really appreciate that. So,
one thing I just want to say to anybody's looking,
go for it.
if you're on that fence, and you're thinking you might or you might not, pull the trigger, right? It changed my life, and I know it changed other people's lives because I see them, right? Being here, you meet people from all over the continental U.S., from Canada, that come here to get their work done. One of the guys I met today, Mike, or met over the week that I've been here, right? He got his teeth today. I got my teeth today. And he can't stop smiling. So if you're on that fence, pull the trigger, because this is a good place and they're good people.
Thank you.
They take care of things. So thanks for letting me be on, Frank. I really appreciate it, man.
Thank you. You told me, hey, I want to be in those podcasts, and I want to say everything. And I told you, what did I tell you? You can say whatever you like.
Say whatever you like.
Because we are transparent. Just like we are in our clinic, we are in the podcast. We are not going to say, no, you can't say that. You say whatever you want to say. Yeah. And we're just happy that you're smiling.
You know what? Here it is.
So
at the end. Where am I at?
Roller coaster right here.
I'm way up. I'm so far above what I thought it was going to be.
Thank you.
That's awesome. Thank you so much, brother.
Hey, no problem. And thank you for having you on.
Yeah.
And don't forget to like. Don't forget to subscribe. Like he said, pull the trigger. Don't waste more time. Come down. If you choose us, great. If you choose somewhere else, wherever you decide, do your homework. Just get it done. It is worth it. It is. There's some ups. There's some downs. But if you choose right, there's going to be a lot more highs than lows. And then you want to stay on that high. And that smile says it all right there. So thank you so much for being here at Supreme Dental Podcast. where smiling starts here. Thank you. Have a good one, guys.
Thank you.